facing up. The question is, the answer is no. I can do it also facing up, facing down, but facing up is a lot easier. So yes, when they are facing down, you can massage the arm, and if we'll have time, I'll show you. But when they're facing up, you take the arm. There is actually, you can massage here. You can then lift it. You can do the forearm completely. Then you can massage the front and the side. If you want to massage the back, you can put it here. You can massage them on the body. Or you can come from above and hold it and then massage from there. So it's a lot more opportunities to give massage in a different ways. Yeah. So just to be sure we're all on the same language. Anatomically, we're not going to do the palm now. We're going to do it some other time, but we might do a little bit. So this area called the forearm, and which bones are there?
The radius.
Radius, remember, that's the radius, and that's the ulna, and humerus, good. And the humerus attached to which joint, to which bone?
Scapula.
Scapula. And scapula is on the back here. And then what's the name of this bone? Clavicle. Good. Okay. Fantastic. Good. So one problem that arises with massaging the arm, that as opposed to other part of the body, is kind of floppy. So when it comes to massaging it, you see, for example, to put it even, sometimes you would have kind of difficulties. So imagine when you're massaging, yeah? Good. Imagine when I'm massaging, look what happened to his shoulder, you see? Imagine that I need to do. It's kind of uncomfortable, isn't it? Yeah. So to start with, the problem is that you have to fix that part of the hand. So at times I can work only with one hand, yeah? Or even swap these. Yeah? But be sure that that kind of things doesn't happen, because it's very uncomfortable and they wouldn't feel comfortable. Okay. So let's start. Let's start with the forearms. In the forearms, two more things before we're starting. Actually, the arm can be quite long. So at times your position, you have to be smart with your position. If I start here, when I get into there, look what will happen to me.
You're going to fall down on him.
Almost, or hurt my back. And I think that a lot of you, your starting position is good, but you run out of space very quickly. So many times you have to start here and then move yourself. And it might be that some of you need to do the step to do that, yeah?
Do we start with a hold on the arms?
No, you can, but you don't have to. Okay. And one more thing is that, where does the arm finish? Is it finish here or here?
Around the shoulder.
Yeah. I actually think about it that the arm end up in the occipital. Yeah. So think about that in terms of a line, Jody. You know, we talked about lines, how wonderful this line is. Look about that you actually finish the arm here. Yeah. Even you take it round to the side. So think about it as kind of end here. Yeah. And it kind of makes sense, because this is where you kind of end up with. Even, you know, you can do that. It's great because you give the brain a sensation of continuation. It's not segmented. Yeah. And after that we'll learn that some of the muscle that hold the shoulder in place really start from there. So it makes sense also functionally to do it. Yeah. That kind of long. Okay. Doesn't mean that every stroke you do, but once in a while it would be nice to do that kind of stroke and stretch it all the way up. Okay? So once you do effleurage, and you do it only to the front, after that I'll show you to the back, you can now start working in segment. So I will bring a chair. I always like to work with a bit of a chair. Yeah, thank you, Heather. Yeah. So it's called the proposal position. You know. So we start getting into technique that we're using mobilization of joints. Yes. So with that, mobilization is when you're moving the joint. With that, sometimes comes a bit of tension from some clients to how well they allow you to move themselves, how relaxed they are. So just be aware that sometimes you will need to kind of play tricks with them, even to do just that, to relax them and let them feel what relaxation means really. It's not easy for some people. So you start by working on the forearm. In the forearm we have two groups of muscle. Yeah? I want you to take your hands here. The first group is the anterior group. The second one is the posterior group. So you need to work on both of them. If the arm is in neutral, it's kind of very easy. This is the posterior group, and this is the anterior group. So you can work it in few ways. You can do it that way, just by clumping two fingers and just stretching it. Or you can do it in different position, like that. Good. Or a bit more kind of petrissage, yeah? A bit more movement and trying to isolate this and separate these muscles here and on the flexor. So it's a little bit funny because you start to think, where is this? Where are these muscles? So one is really to the outside, more is to the inside, but I'll let you kind of try things out and see where they are. Yeah? Who do you think would be good to work with on the forearms?
Builders.
Builders?
Handicap.
Yeah.
Who don't have limbs.
Yeah. So they
limbs.
need to lift themselves.
Yeah.
Maybe crutches. People with crutches. Remember that kind of fracture
Scenario,
with the scenario we did last time. Who else?
Elderly as well.
Why?
Well, this is from personal experience.
Okay.
I don't know why, but just
You
my
stick.
grandma likes it on the arms.
Okay.
It's just,
Yeah. Maybe it's kind of very kind of nice and
Relaxing.
soothing, and you don't have to undress for that.
Yeah.
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 Who else? Big chunk of
Physiotherapist.
yeah, massage therapist also. And
Athletes.
yeah.
Chefs.
People who
Yeah.
work on PTs.
Yeah. Exactly.
Yeah, chefs.
So a lot of typing. So a lot of people would have tenderness here. Yeah. So again, you can do the effleurage. Good.
Can I ask, is the effleurage similar to the legs in the fact that you're not trying to put pressure coming down, you're only putting pressure towards the...
Yes.
Yeah.
Yeah. Yeah. And then you can do the petrissage this way or bend it. And when you bend it, you're just putting your elbow here like a support. Yeah. Good. Once I find a place, here I am ready for compression.
Even on the arms.
Yeah. And now with a bit more friction, side. How is the pressure?
It's okay.
Can I go deeper?
No.
Yeah. It is a tender place. A lot of tension there. From most of us, yeah. Good. Good. Once in a while again, take it to the suboccipital area. Good. Then you can start working on the shoulder itself. You can put the arm in here. You can come and massage the shoulder itself. Really nice. Do you know the name of the muscle that I'm working on now?
Trapezius.
Actually, trapezius would be tiny bit deltoid.
Deltoid.
So deltoid and trapezius, yeah. But you can actually work on both. I actually worked on both. So yeah, you were both right.
Because you're doing the trapezius with the fingers, aren't
Yeah,
you? And
yeah, with these fingers and with the other hand, the deltoid. Good. Now, if I want to work on the back of the arm, I can do one of these. I can bring it here. Yeah, even come from the opposite side. And it's nice to just kind of do it this way. Yeah, if the breast is on the side, on its way, you can move it a little bit downward and then do it this way. So I need again to hold it and to keep it this way. Even do a nice movement all the way. Yeah, nice shoulder. I'm on the back of the arm, very easy. Yeah. Good. Yeah. And even further, you can bring it upward. So come downward, please, and then go all the way down so you could see what I'm doing. And then you're holding it onto your body. The holding is quite important because I want you to move with, and later in the course we'll learn a lot more about this technique, and then you move your body. You don't move the arms, you move your body with. Yeah? And then you have a wonderful opportunity to massage the triceps muscle, which is on the back. It's okay if you don't know this muscle, you will from next week, from this week, yeah, from tomorrow. We'll learn a lot about these. Yeah? And while you're doing that, move a little bit. Again, it's nice combination to just move and do petrissage or work on compression. If needed, that's kind of unusual place, but some athletes would be really good to work on. Yeah. And then even nicely to just finish it with a really nice stretch upward. Yeah. Even just a nice complete relaxation this way, and it will open, we'll see kind of a lot. It opens the chest and all that area that we're all very
Were you
relaxed.
pulling on his arm there, or just?
I pull it,
shaking?
yes, I stretch it a little bit that way, yeah?
No one tickle him.
Take him with you.
Yeah.
Yeah. So again, coming from here, starting all the way, and then doing the forearms, and then doing the arm itself, swapping. You can do it now from this side, working on the triceps muscle from here, or from here that way. I know it looks easy, but when you start it,
Eyes closed.
okay.
I know it looks hard, but when you do it,
Okay. Shall we start?
Okay.